special films intravenous therapy. So if you see the special films in this, first we have oblique. The special film have oblique. The oblique view. This oblique effect. This oblique view. The ureters every the spine. So as a result, the ureters can then it will also help in realization of to be posterolateral aspect of bladder. The posterolateral aspect of realized by the oblique, and this oblique will also differentiate between extrinsic and intrinsic or bladder, extrinsic or intrinsic, whether the renal tumor or renal masses or ureter, or whether the bladder masses from the urinary tract or outside it can be made by oblique, and this is also used for urethral masses also. So, so oblique view is mainly used in order to visualize the ureter properly, because it will make the ureter away from the spine, and it will also separate few opaque shadows which can mimic or which can look like caliculi. It is also used to visualize the posterolateral aspect of the bladder and to differentiate between intrinsic or intrinsic ureter bladder mass. Then we have erect film. In the erect film, this erect film will increase the emptying of fat because of the gravity. That will show layering of caliculi, the cysts, how the caliculi are seen, cysts and abscesses can be seen by erect. And this erect film will also detect urinary tract, detect the urinary tract gas also. Actually, this urinary tract gas is not seen in other films, but in tract gas, and it will also show, or it will also demonstrate or detect this, or if there is any bladder herniation, like erect, or areas of obstruction also found out by erect. That film will increase the emptying of tract, layering of calcium, the cyst or abscess, to detect the tract gas, also help bladder hernia or any. Then we can also take a prone film also. But why is prone film useful? Prone film is actually used for ureteral areas. Normally, ureteral area supine position. So for ureteral areas, we can use prone position. Will also demonstrate or detect this, or if there is any bladder hurt by this film. Finally, the last type, there are also some delayed films, intravenous urogram. Delayed films actually 1 to and 24 hours after. Delayed films are taken 4 hours, and in delayed films, before using delayed films, foremost the patient is guided before delayed films. Delayed films, delayed films
In the delayed films, we have delayed films are taken 1 to 24 hours after injection. So, before taking the delayed films, we ask the patient to void, because once the patient micturates, then the calculus which is present in distal ureter is seen well. The calculus present in distal ureter is seen well. So as a result, we ask the patient to void for delayed films before taking the delayed films. Then, if you see the timeline of events or sequence of films taken in intravenous urogram in delayed films include: we take films after 1 hour, 3 hours, 6 hours, 12 hours, and 24 hours. Delayed films are taken 1, 3, 6, 12, 24 hours. Now, when do you actually use the delayed films? When do you actually use the delayed films? Delayed films are Uses of delayed films. Delayed films are used in cases of obstruction. That too in cases of obstruction where early nephrogram is seen. When you do an early when you do IVP, intravenous urogram, then early nephrogram is seen. But whereas if you see the collecting system, the contrast does not fill the collecting system. That is, collecting system is not seen. In such cases, we do delayed nephrogram. Then, if the patient has long-standing hydronephrosis. If the patient has long-standing hydronephrosis, in this in these patients with long-standing hydronephrosis, you can see renal parenchyma. Renal parenchyma is seen in these patients also, but collecting system is not seen. In these cases also, we do um, this delayed nephrogram or delayed filming. Delayed films is also done in long-standing hydronephrosis. It is also done in some congenital disorders, like in, for example, if the patient has congenital lesions like if the upper calyceal system is not visualized. That is, in a child, if there is non-visualized upper calyceal system, if the upper calyceal system is not visualized, along with that, if the patient or if the child has ectopic or obstructed ureter, in such cases we do delayed films. Then, one more important thing is in neonates. In neonates, if you see the excretion of the contrast medium in neonates is delayed, because the excretion of contrast medium in neonates is delayed and prolonged. So even here we have delayed films because of immaturity of the tissue. So these are the special types of films which are taken in for intravenous urography. Thank you.